Hey guys, what's up? This is Stephanie and welcome back to my channel. So I have another video for you guys today, and in the video today I want to talk about my psychiatry rotation. So I'm currently in spring. My psychiatry rotation was my first rotation, so I did that rotation in mid-January to mid-February, 5-week long rotation. And I'll say that I have to be honest with you guys, before starting my clinical rotation, my clinical year, there was several rotations that I was not looking forward. And psych was definitely one of the rotations that I was not looking forward to. Even though when I took the class during clinical medicine, so during my didactic year, I really enjoyed the material, I really enjoyed the pathophysiology, the medications. I actually did really well in my clinical medicine part, my patho, and for that whole block of rotation of, medicine of psychiatry, I did really well. So, I mean, I'm surprised I just wasn't very excited about the rotation at all. So I did the rotation. The good thing about my program is that if you are able to find a preceptor or a doctor or a PA or a nurse practitioner or someone who is willing to take you that is not in the area where the school is located at or the school is affiliated with, if you fill out paperwork and you send it to them, they will let you do it. So for those of you who are new to my channel, I'm a clinical year student. I go to UTRGV, so that's in like southern Texas, in the Valley of Texas. And my husband, he lives in El Paso. And so I try to spend as much time as I can with him. Whenever I have free time, whenever I have breaks, I fly or I drive depending on how I'm feeling, and I go visit him. So during this rotation, I got the opportunity to do this rotation in El Paso. So I was very, very happy because during that time, I was able to spend time with my husband those 5 weeks. So during my psych rotation, the first few days, I have to say that I didn't know what was going on. Thankfully, during that rotation, there was another PA student that was doing the rotation with me, and she was also from another Texas program, and she was awesome. She had already completed her first week, so she was on her second week, and she already knew how to do things. The first day I went in, I have to say that I did get thrown into seeing patients. So I went to the clinic, and the doctor expected me to start seeing patients right away. And that's always really, really nerve-wracking because I'm so accustomed to my previous rotations that they kind of baby you. So you shadow the doctor for the first few days, if not the first few weeks. And then after finally, like maybe the last week or the last 2 weeks, you start seeing patients by yourself. So you start seeing patients by yourself. And that wasn't the case for this clinical rotation. I was thrown in literally like the first day I started seeing patients. And I was really nervous because I mean, psychiatry is completely different to what I was accustomed to because, you know, for my previous clinical rotations for my surgery, I had done OB-GYN, I had done ER. We carry our stethoscope around and we do the vital signs, or we listen to their cardiac, pulmonary exam, etc. And for this, it's like you never use your stethoscope at all. And the type of questions you're asking when you're taking the history is completely different to the type of questions you were asking during my surgery or my other rotations. So for the first few visits, like I was shadowing the PA student, just basically she saw the first 2 patients, and after that she's like, okay, write notes and then start seeing patients. So that same day I started seeing patients, and I have to say it was very, very nerve-wracking, like I said. So basically I would go into the clinic, they would give you a keyboard, it would say the patient's name, the previous diagnosis, if it was a follow-up, the medications that they're on. And basically what you do is that you just go in and you see the patient, you ask them how they're doing, how are they feeling on the medication, and whether they're having any side effects from the medication, whether it's not working, etc. So those were the questions that we would ask on the follow-ups. And basically, how is the medication controlling their depression, their bipolar, etc., whatever psychiatric condition they were being diagnosed with. Now, for those patients, it was a little bit quicker. I would say it would take me about 10 minutes to 15 minutes the most to see these patients. But for the new patients, those were the ones that took forever. Because it was a completely new patient, you would just see whatever they were coming in for. Like, for example, they're feeling down or they're feeling angry all the time. And you had to go in and get everything, like the complete history. And some of these patients really like to talk a lot, which is good because I'm actually, what I learned about myself is that I'm a really good listener. So I can actually sit down and hear the patient, listen to them, and sometimes they just want someone to talk to. So I found that I was really, really good at that. So in these situations, for these new patients, you have to make sure you get everything. You get their past medical history, if they've ever been diagnosed with any psychiatric illnesses, if they have ever taken any psychiatric medication in the past, if they've ever been hospitalized for any psychiatric illnesses, their past family medical history, any family medical history for any psychiatric illnesses, etc. What was the highest education level they had completed, if they had any trauma as a child growing up, whether it was abuse, etc. So it was really, really sensitive questions that you would ask these patients. And sometimes, of course, when I asked certain questions to these patients, you would find that they would start breaking down, crying. So with these patients, it took me a little bit longer, sometimes 30 minutes, 40, 50 minutes per patient for the new ones, because you have to sit down and talk to them and see what medication they want to take, what's the correct dose to start them on. So this is basically how my first day went and how most of the days went. So my doctor has a clinic, so we would go see patients at his clinic in the afternoon, and in the morning we would go round in the hospital with him. So I would wake up around 8:30 in the morning, 8 a.m. in the morning, be at the hospital by 8:30. It's a psych hospital. So he sees a variety of patients. He sees inpatients, he would also see adolescents, not children, adolescents. And we would be there from 8:30 a.m. till around 3 p.m. And then usually at 3 we would drive straight to the clinic and be there from 3 to 6, 3 to 7 depending. So I know like I had posted a video on my Instagram about my psych rotation, and I had said some things about how it's been a really, really busy rotation, because it really was. And I got some comments from some individuals saying that they thought it was a psychiation, and most of their fellow classmates, or they've heard other PA students say that psychiatry is a psychiation. Basically, it's a psychiatry vacation. It's one of the easier rotations compared to the rest of the clinical rotations. And honestly, I was expecting that, because most of my classmates had also different experiences than I did. But I have to say that for me, it definitely was not a psychiation. I did Monday through Friday. Some weekends I did every other weekend, so I would go in Saturdays every other weekend, and I would go in like I said at 8:30, sometimes get out at 6 or 7 depending what time our last patient left. And this was the routine, Monday through Friday. Weekends it would be from 8:30 till 5 p.m., 4 p.m., a little bit shorter, but still. So it was really, really long days. And sometimes we had so many patients in the hospital, like we would see so many patients, probably about 30 patients in the hospital in the morning, and that includes adolescents and adults. And sometimes we wouldn't finish before 3 because we start seeing patients at 3 in the clinic, that we didn't get a lunch. So me and the PA student I was with, we never got a lunch. So I ended up just taking meal replacement drinks and just drinking them on the way when I was driving over there to my psych rotation. But I have to say that I really, really, really enjoyed this rotation a lot. I could actually see myself being a psych PA. I really like listening to people and seeing basically what medications can do for an individual. For example, in the inpatient hospital, I have to say that we did see a variety of patients. We saw patients that were manic, bipolar, depressed. I saw patients getting restrained. I got screamed at, I got cursed at by patients, and I mean, there was times that I was like really scared. We had patients that thought that they had parasites inside them that were eating them apart. I mean, we had a whole array of things. I was able to experience not only how psychiatry is in the clinic, but also how psychiatry is in the hospital, or hospital medicine. So I really, really enjoyed the rotation. Like I said, I also got to see what medications and how antipsychotics work, what they can do for a person. We would have a patient that would come in the first day and they were extremely manic because they were off their medications or were taking the wrong medications. And then my doctor just would treat him for 7 days, and by the time the patient got discharged from the hospital, they were a completely different person. So it was a great, great experience. I really thoroughly, I can say, enjoyed my psych rotation. So for those of you who are going to go into your psych rotation or interested in psychiatry, I really enjoyed psychiatry. Like I said, I got to see patients on my own. In the hospital, what I did is that when I got there at 8:30 in the morning, my doctor didn't arrive to the hospital until 10 or 11 a.m. So I would get there at 8:30 in the morning. I would go through all the patients' charts, see how many new patients we had. Because like I said, for every new patient, whether it's in the hospital or in the clinic setting, it's a lot of paperwork. So I would start with the paperwork before the doctor would get here. That way there wasn't as much paperwork, especially if you had a lot of new patients. Like say on a Thursday we had like 5 new patients, it would take me about 10 to 15 minutes just to fill out the paperwork per patient. So that's why I would try to get there beforehand, try to finish before the doctor came in, that way we could be finished with the paperwork. And so I got there at 8:30, would go through all the patients, see which ones are new, and then I would go and round on every single patient. So I would ask them, how are they feeling? Are they taking all their medications? Are they having any side effects from any of the medications? It's really important to ask them whether they are compliant with their medications, because there's some patients that just don't take their medications because they don't think there's anything wrong with them, or just don't like their medications because they don't like how it's making them feel. And so I would ask them if they were taking their medications. I would then verify with the nurse on whether they were taking their medications, and also the nurse was always your point of contact for how the patient was doing. So they would tell you how the patient was behaving, whether they were being aggressive with other patients, whether they had to be restrained, etc. And then I would always ask the questions every single day to the patient to see how they're progressing. Are they having any hallucinations? Having any illusions, any side effects, etc. And then I would ask them these same questions every single day, and you would see how they would improve or not improve. Some patients would say that the first set they came in, I had a patient that said she saw flying bracelets in the air, and then on the last day she's like, no, I don't hear voices anymore, I don't see these bracelets anymore. So you would see that change how these medications work, so I really like that. And then also in the hospital where I worked at, my doctor was also specialized in addiction, so we saw a lot of patients that were addicted to medications, alcohol, that were being admitted to the hospital. We saw adolescents with depression, bipolar, etc. So it was a great experience. On top of that, I was able to work alongside PAs throughout my rotation. I had another NP student that came in, and then I had a medical student. So I rotated with the medical student, the NP student, the PA student by the time I finished my rotation. So this rotation was very autonomous. I was able to see patients on my own and be able to diagnose them, be able to write a treatment plan in the hospital. Me and the other students worked as scribes, so I got really familiar with the paperwork that you fill out for patients that are in the psych hospital or in the psych clinic. I got really familiar with the medications because I was in charge of writing the doses and the medications. So it was a great experience. My preceptor was a little rough, but I learned a lot. It's always the ones that are rough and they give you a lot of work to do that you learn a lot from. And on top of that, I also got a job offer, so it was fantastic. I really enjoyed my rotation. I met, like I said, I'm really good friends now with one of the PA students I met there. I talked to one of the medical students, and I made a lot of connections, and my doctor was amazing. So yeah, that was just how my psych rotation went. If you guys have any questions about the rotation or anything like that, or if you guys have any questions for me in general, make sure you shoot me an email or comment below, and I will contact you as soon as I can. Alright guys, I'll talk to you guys later. Bye.